Hello and a very warm welcome to everyone. I am Shrija Agrawal and you are watching the fifth dispatch in our series, India Restart, Meaningful Dialogues on India's Path to Recovery. In the past 3 to 4 discussions that we have had as part of the series, we have clearly focused on path to economic recovery for the country. Today, we are discussing a crisis which is non-economic but an extremely deep one. Yes, the mental health crisis. Humanity has rarely experienced such a collective sense of vulnerability, a dual threat to the body and mind. While the effects of COVID 19 on physical health have been fairly documented, its unprecedented psychosocial health effects have not got the required attention. For centuries, we have prided ourselves on the ability to deal with mental health through various indigenous ways, particularly the strong social networks. Physical meetings, celebrations, and gatherings are connections that strengthen us and replenish collective mental energies. With physical and therefore implied social distancing being enforced globally as one of the most effective ways to deal with the physiological aspects of the pandemic, the social networking that aided mental well being is suddenly missing. In the sum, COVID 19 has inadvertently fast tracked attention to this mental health time bomb. Doctors and caregivers who work around the clock away from their families, risking their lives for others, are being ostracized by their communities. This is enough to even cause stress to the most resilient. We have with us a very meaningful panel today. We have renowned experts talking on this subject who do this as part of their daily lives. Plus, we also have a successful entrepreneur who can provide an outside in view to the issue as he's building out his organization. Please help me welcome Dr. Gururaj, Director NIMHANS, which stands for National Institute of Mental Health and Neurosciences, who brings with himself about 30 years of extensive experience in the field of public health and health system. Also, please help me welcome Vikram Patel, the Pershing Square Professor of Global Health in the Blavatnik Institute's Department of Global Health and Social Medicine at Harvard Medical School. Also, please help me welcome Vinod Tharakan, Managing Director of Claysys Technologies, a software product firm, and they have banks such as JP Morgan and Wells Fargo in the US as their clients. They work also very closely with the US Paycheck Protection Program. Gentlemen, it's my sheer pleasure and privilege to welcome you all to this program. My first question really would like to understand more about the outside in view before I get to the experts who would be on this subject part of their daily lives. With COVID, one obvious impact is the financial impact, which I think we have fairly well documented and spoken a lot about in this conversation. It's faced by large numbers of people in society. But besides the financial and economic impact, their mental health is impacted by many more issues, especially on restrictions on social interactions. So maybe I would like all of you to have opening comments on how you are seeing this duopoly of economic plus social distancing really sort of feeding into this mental health crisis further. I can begin with you, Vinod, and then go on to the experts.
Yeah, thank you, Shrija, and thank you for having me. Right, so this has been a very interesting year, obviously, and with regards to the mental health issue, our perspective that I would like to share is primarily around two types of human resources in two key industries. One is technology, which is the software industry that we are in, and then the other is construction, which is again another sister company that we have. The interesting thing was when we first went through the lockdown in March, it was a surprise and a shock to everybody. And then when we transitioned to a full lockdown, from the month of April, we were very lucky in the technology industry because this was actually possible to go through that process of getting all the infrastructure with our staff to work from home. And incredibly, it really worked out well. On the software side of the business, we've been able to successfully have everybody work from home. And we've actually seen a net productivity gain of maybe almost 20%. So I don't think we're going to go back to the old normal because the work-life balance is better for our staff and the productivity is better. And there are a number of factors that definitely indicate that going back to the old 9 to 5 work in the office building concept is not coming back, at least for us. And when we talk to a lot of peer companies, they have the same perspective. If you look at our construction business, it's the exact opposite, right? I mean, the moment we had the lockdown, we went down literally to zero. And right now we might be at 10% trying to get some work done. and the stress levels with our staff are a lot more. I mean, in our case, we were lucky that we did not have to lay off any people. We've managed to sustain, just given the situation, keep everybody on board. But I would say their mental stress levels are very high because there is no end to this. And everybody is trying to wonder, how can the company sustain them if there is no productive output coming out of their involvement, right? So that's been a concern. So the practical side of this has been, I think, all these, especially in India, I don't think there's enough thought given to the mental health situation. Everybody looks at it as only once you cross a certain tipping point and an individual is practically out of control and seriously needs some kind of conditioning or treatment, so to speak. Up to that point, everybody ignores it, right? But what we've seen is the build-up, even in our software company, the stresses involved in spending an extended amount of time with people who are close to you, but still in a confined space, has its own challenges. And we very objectively see that impacting productivity. So even though practically we are able to work, this is an area that is something we've never had to deal with before, and is definitely a problem. So I would say in my opening comments that especially in India, I mean, we see it slightly different in the United States where we do a lot of the work. But in India, there's a complete lack of acceptance of this issue even existing. It's not even considered a factor, unfortunately. But practically, we do see it as a big problem. So I'm really excited to be on this panel to listen to the esteemed feedback from our guest today. So thank you.
Okay, I come to you now, Vikram. We just heard from Vinod, and he said that mental health is affecting productivity, and he gave a practical insight into it. And I'm hearing this from a lot of entrepreneurs and startup guys that the new normal is essentially increased productivity hugely. So while in technology companies you're able to do that, the work from home remote culture, but the reality is that the pandemic has also costed a lot of people their jobs. So whilst there's economic recovery, which India has a path laid out for, there's social distancing, how does one deal with this quagmire, which is leading into mental health in a big way?
Yeah, so, first of all, I just want to say that there was a crisis well before this pandemic. I think it would be, first of all, important to recognize that the government's National Mental Health Survey, that was in fact led by NIMHANS, and I'm sure Professor Gururaj can speak more to that particular point, identified roughly about 100 million Indians at the time of this national survey who would meet clinical criteria of a mental health disorder. And about 80 to 90% of them, depending on the kind of condition and where you lived, had neither received nor sought any care in the previous 12 months. This would be the largest unmet need for care for any health condition in this country. And so let's be clear that there was a crisis, and there has been a crisis for the last 70 years since independence in terms of mental health care. Uh, what the pandemic has done is it has pushed this crisis into the spotlight. And there's no doubt that I think there are certain factors in the pandemic that Vinod has very clearly alluded to, which are going to make mental health needs grow considerably in India. But I think the point you're drawing attention to, Shrija, is the disproportionate impact of this crisis. And it's really important to also flag that up. As we heard from Vinod, there are multiple different kinds of employment sectors in the country. And some, such as mine, I'm an academic, I have been able to move seamlessly from what I used to do in person to being completely remote. And actually, the quality of my life after the initial sort of uncertainty has actually improved tremendously because I don't have to travel anymore. I can choose to be wherever I am and continue to fulfill my professional obligations. But as we heard, most jobs in this country do not fit into that category. By most, I mean more than 80% of Indians work with their hands. They actually work in daily wage jobs. And I think this is the disproportionate impact of this pandemic. This very, very large section of India's economy has been very severely hit by the lockdown and it's not just the lockdown, it's also the broader consequences of the economic slowdown. You see this in all countries, by the way, the restaurant business, the airline business, so many businesses have been very badly hit. And I think one very important factor that has been demonstrated time and again is the relationship between social disadvantage and poor mental health. I want to draw your attention to this landmark work by Angus Deaton, the Nobel Prize winning economist from Princeton University, who published a book along with Ann Case earlier this year called The Deaths of Despair. This is a term that's getting a lot of currency in the US, and I believe that we should also be listening and reading that evidence here in India. This is about the reduction in the life expectancy of working age Americans following the 2008 financial crisis. And all of these deaths, so, this is one of the only wealthy countries in the world where life expectancy has actually stalled and even fallen. And the entire contribution of the increased mortality that has occurred has been driven by suicide and substance use. Now, this is what these economists refer to as the deaths of despair. And you now see these terms being used more and more widely in the medical literature. So if you do combine suicide and substance use related mortality into one bracket, and these are fueled by poverty, indebtedness, and a variety of other forms of social disadvantage, then I really fear for India, because India already has the largest per capita suicide rate in the world, even before the COVID pandemic. 1 out of every 3 women who commit suicide in the world are Indian, and 1 out of every 4 men who commit suicide in the world are Indian. So just bear that in mind as we think about the impact of this pandemic on the mental health of people in this country.
Dr. Gururaj, I just come to you. I think Vikram has very, very sort of clearly and very well sort of highlighted the fact that deaths of despair is a conversation which is increasingly becoming mainstream, and how Indians really top the chart when it comes to suicides. I really want to understand from you, really, that are you seeing some increase in the way people are talking about mental health issue right now? Has there been a substantial rise in psychiatric and neurological disorder after the COVID-19 pandemic? I mean, we have seen this in the aftermath of 1918 Spanish flu pandemic. There was a marked increase in incidence in psychological and psychiatric illness incidents. These conditions are now often referred to as the post-viral syndrome, increased hospital admissions. Can you give us sort of some in-depth details about this? How you are seeing the pandemic is really feeding into actually the mental health cases increase, and if you have any comparisons to previous pandemics, so to speak.
Uh, Thanks, Rija. Thanks for this opportunity to be on this panel. Like Vikram said earlier, mental health has been a major issue even before the pandemic arrived. For quite some time, and in the past 2 to 3 decades, the work that has been done in India, even on a very small scale, revealed that mental health is a major issue in this country, which has not been addressed to a greater extent. And there are several reasons from it, starting with the stigma surrounding mental illness in the societies to the limited importance that has been given on the policy and program implementation point of view. But the pandemic only accelerated this crisis, beginning with the first case that was seen in the month of January, the 30th of January. Subsequently, with the increase in cases all over the world, and especially India starting with its pandemic phase in the months of February and early March, the crisis began really to worsen. Because what happened was basically there were people who were feeling that they may catch COVID and they may have to suffer from the infection. And people who had the COVID infection were sort of getting panicky and contacting hospitals or trying to get care in some of the healthcare institutions. And then because of the other rollout effects, the health services was hit very badly, and then there was difficulty for people to access healthcare. The many other things happened because of the combined effects of all this. The mental health issues started increasing, and it's only very recently that it has been recognized that we are really in a crisis. Because especially there are people who are now recovering from COVID infection, but who suffer from a variety of mental and neurological symptoms and different health conditions that impact their life. So on one hand, there was fear in the beginning that people can catch COVID. Those who were suffering from infection went into the hospitals or were in contact with hospitals, getting the tests done and experiencing these symptoms. On the other hand, those who recovered were not really totally out of danger, but continue to have symptoms for the post-viral syndrome, and all these started affecting people. At the same time, it's not just one person who is affected with COVID who really suffers. It's his entire family, his entire, the team, the set of people who live with him, who meet him, who contact him, who work with him, for children who play with them, wherever they are, there are many other people surrounding this person, and everyone started getting affected. So in that way, this COVID has totally disturbed and disrupted every human being, whether it is a child who has to go to a school or whether an elderly person who is at home in his post-retirement period. And by and large, it has affected a large number of the working population. And we know in India, majority of them also work in the unorganized sector. And where, because of the variety of difficulties that really came into existence, their life was affected, their income was affected, their social life was totally thrown out of gear, and everything happened. And all this has a very large cumulative effect on the health of people. So it is not just one particular symptom or a thing that we need to recognize, but a larger problem that has come into the society, and we need to find out ways to address this problem. One important challenge that we have in India is the lack of good quality data, especially the mental health symptoms were not recognized much in India in the early stages of the pandemic. It's only now in recent last 2 to 3 months, studies have started taking place in India. But at the same time, we have experience from the high income countries which have shown that mental health problems are a major concern, not only among the general society, but even among the healthcare professionals. It could be a nurse, it could be a doctor, it could be a specialist, a hospital administrator, anyone who works, and many other frontline healthcare workers who are affected with this pandemic. So in that way, this is a very large crisis that is right in front of us. There are efforts that have begun to address this crisis, but I think as we go along, we need to do much more, not just only from a treatment point of view, but to look at it from the economic angle, from a social angle, from a cultural angle, and from a holistic perspective to manage this. Because the pandemic is still not over, and we are at a stage where we are just seeing some early indications that it is on the decline. But with Deepavali right in front of us, starting today, and in the coming days, the holiday season of December, Christmas, everything coming up, it could take, the trajectory is still not very clear. So we need to be mindful of this, but we need to address the mental health issues. Let's also remember that mental health doesn't stay in isolation. When one's mental health is affected, it affects his physical health, it affects his emotional health, it affects his family health, and it affects a whole lot of other things. So mental health is very central to the happiness in an individual's life, and if that is gone, everything else is gone. So we need to pay more attention to this particular aspect.
Thank you, Dr. Gururaj, for sort of stating those facts to us. Vikram, I sort of come to you now, and what Dr. Gururaj just mentioned, that the pandemic is still not over. And with the festivities coming in, I think there's only a possibility of this to only accelerate, if not deteriorate. I want to understand from you, and I think all three of you really established this aspect and point that we are into a deep mental crisis. Perhaps the pandemic has put that into a spotlight, but we need to realize it was very well prevalent even before that. So I want to understand from you that if there's so much recognition of this fact about mental health crisis, why don't we have an educational system very well equipped to deal with this, especially the negative emotions, talking about a huge spectrum of emotions out there: jealous, envy, pride, ego, empathy, schadenfreude. You think our educational system has not done enough to really focus on this? Many people, of course, get wise to negative impacts too late in our life. And why is the educational system really not focusing on these issues with the objective providing people with the tools to deal with these emotions in a better way? And you sort of, do you think that perhaps the developed world has fared better in this regard than us?
So I want to just maybe first of all start with the word, the educational system. In our country, in India, the educational system has been primarily seen through the lens of the name education. That's what it's there for. It's intended to teach young people a range of different subjects that can make them effective employees in our economy, to find jobs, etc. And I think that is what all of our, or anyone who has been a student in any Indian school or university will realize, that almost 100% of the focus of that institution is pedagogical. It's about learning, which is, of course, the same everywhere, by the way. This is not just unique to India. This is what the function of the education system is everywhere. I think the problem, though, is twofold. First of all, that we don't use this opportunity of 10 years that children and adolescents are within this incredibly useful platform in which you can teach them other things as well that is beyond curricular subjects, what we call life skills. There is actually quite a large literature on this. Life skills are just as essential, in fact, I would argue even more essential than any particular subject in terms of being effective in your adult life. And that includes, of course, all the points that you mentioned earlier, like, for example, managing difficult emotions or volatile emotions much more effectively, etc. But unfortunately, when life skills is taught in India, it's taught like another subject. I've seen life skills curricula being rolled out in schools, and it's taught as if it's biology or chemistry, rather than the whole purpose of life skills, which is a totally different kind of learning experience, which involves a lot more peer interaction, teachers who actually are using the skills themselves to demonstrate to students how they can role model their teachers. So unfortunately, life skill, and also life skills is not counted as a curricular subject, so therefore it's often devalued in the education system. It's just done because it has to be done. The life skills curriculum needs to be, of course, taught much better. And I think if it is, some of the deficiencies that we've just discussed will be addressed. But the second problem, and this is a structural one, is the incredible competitive nature of education in India today. The fact remains that we have a kind of a bottleneck. We have large numbers of students growing every year who are entering primary school. Our education system has done really well in increasing enrollment. We have nearly 95% enrollment in primary school in India, which is a huge achievement. Our retention rates are improving constantly, so larger and larger numbers of young people are completing, high school. But what's happening at college? There is a growth in the numbers of university places, but the vast majority of those places are mediocre. And so there is a huge number, a growing number of students all competing for a relatively small number of desired university spots. And this intense competition is like a pressure cooker. I experienced this, let me tell you, when I was a student in Mumbai, and I'm sure Professor Gururaj did as well. But the pressure has grown manifold in the last 3 decades. And so my own son could not aspire to get into a medical school the way I did, unless he, never slept at night and spent his whole day and night just simply reading, because there's so much more competition in the system. So I think this is a structural challenge, and no amount of life skills training in school is going to address the very nature of this intense competition for the few places in the desired universities in our country. And this requires a high level policy intervention that raises the standard of the large number of mediocre universities so they become attractive for students who are leaving school to apply to get into admission.
Vinod, would you like to add to that? Vikram just mentioned that there are structural issues and the fact that the way life skills is also taught in schools as if it were a subject. It has to be more peer-to-peer conversation and more practical. Do you think that some of the employees, the challenges that your employees felt could have perhaps been mitigated had they gone through a proper and effective life skill education from a young age? Because I'm sure they're very good technicians and great at their job, but this mental health issue is directly impacting their productivity now.
Right. So a couple of points that Vikram brought up there, I think, are very relevant. From our experience in dealing with the actual outcome of this problem, right, in the work environment, what's been very interesting is just like any other problem we try to address at work, we've been trying to dig into the root causes. So, for example, we don't have an official HR department as such. We call it our employee welfare department because it goes a little beyond just the procedural part of HR. And the reason we are trying to do that is because what we see is the foundational aspects of this problem. And let me just objectively explain what I mean there. What we are seeing is, and this applies not just to our staff, I can relate to it even myself, right? These basic emotions like jealousy, envy, pride, ego, empathy, sympathy, Schadenfreude, etc. These basic emotions, we are in our journey in life, we are always told that the negative side of these emotions, we are always told you should not feel this, you should not do this, you should not do that. So we all understand the what, right? What is this? We understand that, and we use it in everyday discussions as well. The problem that we are seeing is nobody seems to know how to deal with this. So let me give you an example. If my brother wins the lottery for $100 million, my instinctive reaction is not happiness. My instinctive reaction is, why wasn't it me? Right now, the when I think about it, I now settle down and feel happier, maybe because I think I can get a few crumbs out of that. So it's a net positive for me. But my instinctive reaction is not a positive, right? So that's one example. But when you boil it down to the basic everyday life at work, the 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 issues that are stimulated because of these basic emotions are political alignments in the office, uh, uh, a behavioral aspect of the work environment, which is not aligned to what our focus would be, which is what is in the best interest of our customer or what is in the best interest of the company. It usually aligns towards what is in the best interest of the individual, which may not necessarily be aligned with that of the customer or the company. So it definitely is a practical issue, and we are struggling to connect the dots on providing the tools or the mental hack tools, if you may, to the staff to help them deal with this better. And this is just the work environment. Believe me, 60% of the issue is not even related to the work environment. It's related to their personal situation at home, right? Whether it's with their family, whether it's with their business unit and such. Now, the other aspect that Vikram brought up, which is that initial 10-year conditioning period, right? I feel that when we have been dealing with this problem, I feel we are seeing that that's the crux of the issue, right? In that initial conditioning stage, you're kind of told in your academic system about what this is, and you got to avoid it, but nobody really tells you how. And because you miss the how, you then stumble through life, encountering these issues, trying to figure things out on your own, and then you end up with all kinds of problems. And by the time you get a grasp of how you should probably deal with it, your life, the productive side of your life is probably almost over, right? So that's one key aspect. The other side of this, which I would also relate to on that example that Vikram brought up on the educational institution side, what is fascinating to see is, especially in the technology industry, honestly, I don't recall the last time that as an organization we have looked at a resume in terms of understanding where as an individual studied. Our primary focus is the skills. So again, the reality is what Vikram has said, which is everybody strives to get into one of these top educational institutions, but we don't see a correlation between the certification behind the skills of an individual and the real skills. And what I mean by that is uh, the way we try to identify individuals that can contribute to the business is, let's say you're trying to hire a juggler, right? You don't really need to go through an interview process. You throw the juggler a couple of balls and see how he can juggle two balls. And you ask him, can you do three? You throw him a third ball, you throw him a fourth ball, and you observe and see, does this individual have the skill? Versus having an interview and saying, hey, okay, you've passed out from the world's greatest juggling institute, and we just have a conversation about how competent you are. So the point I'm trying to make is, it's interesting to see, I think that the world is transitioning to a concept where you're evaluating the skills of an individual versus the background or the certifications. Now, I think it's going to take time, but for an organization our size, we find it a lot more practical to focus on the skill. And we do look at the background, but for us, the LinkedIn social media site is more relevant than going through a self-curated resume of an individual. So I completely agree that there is a lot of misguided energy going into trying to get our kids into these high-end institutions, because again, when we interview fresh graduates, I must say, I would request Dr. Gururaj and Vikram to try and participate in some of these fresh graduate interview processes. It is extremely sad, because I would say 70% plus of the candidates we interview irrespective of what level of institution they've graduated from, I would say at some stage are in a clinical depression state of mind because they're completely broken. They have no idea what they've been involved in for 4 years of, academic hell maybe, and they don't seem to be even ready or enthused about the job that they've now been certified for. So I think going down to the basics is the real issue. And I think the question that's in our minds when we try to deal with this from the outside in is, what are the tools, or is there anything that can be done firstly at the foundational stage, like Vikram said, in that first 10 years of conditioning, and then in their current work environment, um, there's what's the structure that can be put in place maybe to try and help them with what I would call mental hacks, because finally that's what it is, right? I mean, if I don't react, I don't figure out how to be positive about my brother winning $100 million, that negativity is going to continue and it's going to play out in other factors in our relationship, right? So if I don't recognize why I'm feeling a certain way, and then I don't have the tools to decide how to deal with it, that's when I go down the slippery slope, where it's now going to affect our personal relationships, it's going to affect his family, my family. I'm giving a very tangible example, I think, that people can relate to. So that's my take on this. I think it's a real problem. It is not recognized enough in terms of the essence of the problem on the ground. And the focus is on macro level issues, I feel, that honestly in this day and age are not relevant.
Okay, we sort of heard from you, Vinod, and thank you for sharing those practical insights from from what you're seeing in your organization. We went through the opening comments. We did establish the fact in the panel about the mental health crisis being prevalent before the pandemic and how the pandemic is the spotlight to that. Vikram also mentioned points about the structural issues in the education system and how they need to be rectified to have a more practical approach to life skills. Vinod also pointed out the practical examples of how he is seeing the employees' productivity decreasing because of mental health issues. Dr. Gururaj clearly also highlighted the fact that how there needs to be much more from a policy perspective to deal with this. Now, I think this important question really, and I think all three of you really highlighted the fact about India's path to economic recovery is extremely crucial to having to sort of solve some of the mental health issues. This entire interdependence of financial independence and debt is extremely important to mental health. And there's a very active movement today called FIRE, Financial Independence, Retire Early, where many individuals and couples are actually retiring in their mid 30s or early 40s, developing practically very frugal lifestyle. And essentially the core there is to focus on the happiness quotient rather than really the financial quotient, or be sort of really be extremely seduced by the so-called unicorn phenomenon that we have to become a billionaire. I want to understand from you, Vikram, first, and then go to the panel. That do you think that you are seeing more of such lifestyle choices being done by young, especially young Indians, and do you think that's a good and sustainable solution to this entire problem? What do you think? What is your sort of remark on this?
So definitely, Shrija, I do see that. Of course, I see that. I see that in India. I see that in many parts of the world, not just here. In fact, the US is another good example of a place where, young people who have hit the jackpot. As you say, it is a vanishingly rare phenomenon, though. At a population level, it's vanishingly uncommon. Yes, there are individuals and they become known because they're so special in terms of the good luck, their intelligence, their hard work, whatever combination of factors that have led them to become billionaires at the age of 30. But you and I know that the number of billionaires in the world wouldn't, they're minuscule in a proportionate term. I have one of my home in India is in Goa, and I see this a lot in Goa. It's a place where many young people, by young I mean in their 30s and 40s, have retired after making a very large amount of money and invested that, and then they've decided to actually spend the rest of their lives, as you see, retired. I don't know the word retired is necessarily the right one. It is doing different things other than what you do in work, and I think that's wonderful for them. I mean, I have to say I feel that they've made the right choice if they wanted to step away from their work. But the point is that I love my work. It's not the question necessarily that work should be seen in a negative way. It's because the way this point was framed was as if retirement is something that you have to look forward to. Actually, the honest truth is, in my milieu, which is as an academic, people love to continue working because, in fact, as you continue to grow older, you get wiser, you become a lot more aware of your subject, you can look at the subject from a higher level, and actually there's more pleasure because there's less competition as well. As you grow up in the academic ladder, you achieve what you can, and therefore you're also a lot more comfortable with who you are and where you reached in life. So actually, I think retirement as a positive event often has implicit in that idea that work is a pain, that work is something that we really want to get rid of so that we can actually stop working and then our life begins. I think the ideal combination, I would say, in life is how work can become part of the pleasure of living. That work is something that sustains you, that it's purposeful, that actually drives you, and that you find the right balance between non-work pleasure and work-related pleasure. If work becomes a burden that you're looking forward to retiring from, then I think that's a bigger problem. And that is a problem, let me be honest with you, which is far more common than people deciding to retire at the age of 40 and spend their life doing something else. I think, in fact, workplace burnout, stress, and I think, certainly Vinod will have probably a lot to say about that, is one of the biggest issues in the economy today. Mental health concerns related again to some of the issues that I talked about earlier, mood and anxiety problems, substance use problems, are the leading cause of lost productivity at work. And it's a vicious cycle. Workplace stress, a variety of different kinds of factors there, of course, can lead to mental health difficulties, which then affects your productivity, which then in turn actually creates a vicious cycle because it affects your ability to be effective at work. So that is the issue that we need to be grappling with. How can we make work a fulfilling mission for every individual in the workplace?
Vinod, how can you make that?
Yeah, no, I mean, this is the finally all these root cause issues are then impacting the work-life balance of the individual. So practically, this whole concept, and to Vikram's point, I would say when you talk about FIRE or FI, financial independence, retire early, what's more important is the first part of it, which is the financial independence aspect. The retire early concept, I agree with Vikram. I don't think as an individual with any kind of skill you're just going to stop working, right? You might work on your own terms. You might reduce the amount of time you work, and you might do all those kind of things. But you're not. The key aspect here is financial independence, and practically what we are seeing is, and I can give you again an objective example, right? So in the technology industry, we hire a fresh graduate from school, right? For the first 3 years of their life, their salary is doubling every year, okay? And then from the fourth year onwards, their salary is growing by maybe 30 to 40%. These are massive strides in terms of financial benefits as you start your career, right? The interesting thing that we see is there is no correlation between this growth in income and the state of mind, the happiness state of mind of the individual. And that's been very interesting to see, because if you don't, again, this rides on top of the earlier points I made, right? If you don't know how to deal with jealousy, envy, pride, ego, and such, there's always going to be another milestone you're going to aim for and strive for, because you don't kind of review, you don't really look at where you are vis-a-vis where you were. You're looking at, oh my, why am I so behind so many other people? So I think it's driven by those basic emotions. This is my guess, right? Because I'm not qualified to kind of uh, understand why this happens, but our assumptions are it's driven by, because practically we see a connection, right? And the interesting thing there is you then see templates of how this is done better. And I'd be very curious to hear feedback on this concept of financial independence, where this is not about the billionaires. These are individuals who are getting or transitioning to financial independence by reducing their lifestyle expenses and focusing on what matters to them. So if they are interested in travel today with Airbnb and such, travel has become extremely low cost. Of course, with COVID it's shut down, but otherwise that problem is getting addressed in a very positive way. If you look at just getting off the rat race, so to speak, where you're now competing with your peers just to kind of keep up with the Joneses, as they say, like, you want a better car than your neighbor, you want a better home than your neighbor, getting out of that rat race and just focusing on what really matters to you, these in a discussion, these seem very obvious, right? But practically in everyday life, it's very challenging, and by sheer momentum, folks are not really aligning with obviously these factors, and they're just chasing the same perceived dream of materialistic possessions and financial growth. What we are seeing is, and I'm saying this because we're involved in the financial sector in the US, especially with credit unions that work in the communities and such. The larger focus there is to look at the financial well-being of their community members. Their perspective is very different. It's like, how can you provide the guardrails for your constituents or these members to go through their life journey without getting too caught up in debt? So again, when you look at debt, practically inside our company, when we survey our staff, 80% of their stress levels is related to financial stress, related to debt. They would have acquired a home that maybe was a little further beyond their reach, but now they're stressed to pay back the monthly installments looking out 20 years, right? So when COVID comes and threatens your job, you know you've got enough saved away to take care of yourself, but how do you handle those monthly payments if you lose your job, right? So 80% of the stress is driven by that. And then again, the practical on the ground question, in India, how it is, right? So I have a driver, I have myself. I think it's an open question when we discuss this internally, whether my driver is happier than me or I'm happier than my driver. My point being that materialistically, there's a big difference, but does that truly matter, right? And if it doesn't, then what are our priorities? So I think it's a layer on top of those basic emotions. And because that grounding and conditioning is not there, practically what we are seeing, and this is, again, even we see this with our clients, right? I mean, the number one issue we have to deal with most of our engagements is plotting the political landscape. What is the alignment of interest with all the individuals involved in a project? And these are just practical situations driven out of these root cause problems that I kind of touched on. So I think it's a very interesting space. I'll be very curious to learn about the perspectives on what the gentlemen on the panel are going through as well.
Yeah, I think we dwelled on the challenges and the problems quite a bit. I think it's time to understand from the experts on solutions, on the sustainable well-being of individuals. And I come to Dr. Gururaj. We also spoke a bit about the educational system and how that needs to be really changed structurally. What do you think are perhaps 2 or 3 practical solutions that we can really do? Perhaps COVID is a big opportunity. Let's not waste this crisis, and that can be transformational to really deal with this crisis head on. If you were to give 2 or 3 practical solutions, what could those really be?
Yeah, I think, see, basically, some of these problems were there in our system for many, many years, and COVID sort of has brought this out into the open because of the sudden crisis with which all of us, everyone had to go through. Just to come back to the previous discussion point on both issues in workplaces and education systems. For the last couple of years, we have been working with many educational institutions and also in workplaces, because we work on a life course perspective. So we look at different stages of an individual's life. So we have programs called Yuva Spandana and Life Skills Education Program. We have been implementing it for the last 6-7 years now. And whenever we go to many colleges and many workplaces to look at it, there is definitely a lot of stress among people there. But this stress doesn't come out just like that. It's a very complex interaction between finances, between personality, between the family life, between the adjustment abilities, independence one has in one's work. A lot of other factors also matter. But what we noticed was that we looked at both what is it that protects an individual, what is it that puts an individual at high risk. When you look at it, there are distinct characteristics which make an individual quite happy at work. We come across many, many individuals who love their work, who love to work more, who even do many more things. But on the other hand, we have seen individuals who have variety of not just stress-related problems, even physical health problems, could be depression, anxiety, sleeplessness, hyperacidity, many other health problems, which are again closely interlinked to stress aspects. So I think it's important wherever we are to recognize both the positive and the negative attributes that contribute for the health of an individual. Coming back to your question, what needs to be done? I think there are many things that need to be done at different levels. India has made some little progress somewhat in the last few years. We now have a mental health policy, mental health care act, we have increased funding, the mental health programs are getting expanded to many more districts. There are ideas like mental health in workplaces coming in. The school mental health program is getting recognized. So a lot of these things are there. But I think our fundamental problem, in my opinion, seems to be with regard to the implementation at the ground level. I mean, there are many of these things that need to be done. But when we go to a workplace and we see what type of activities are there to promote mental health of the employees, we find it is very, very minuscule. It's much talked about, but not much is happening on the ground. So I think that's one area which requires very strong focus. We know what to do, at least in some of the areas, but it's time we actually do it and put it on the ground and build this entire thing important. Second important thing that needs to be done is integration. We've all been working in silos, health sector, education sector, welfare sector, urban development, finance, all of them work in individual silos. But it's time they all come together. Health and education are so closely interlinked. Health and work are dependent on each other. So it's important to recognize what is it that needs to be done in these places. The third important thing is the settings. I think schools, educational institutions, workplaces, families, community settings, they all give excellent opportunities for integrating mental health into many other areas. It's not just talking about, you should sleep well, you should eat well, or you should work well. It is just how you balance your life, how you take care of the different life skills that have been discussed. In one of the largest series of research studies that we did on suicide, one of the biggest problems we notice among young people and adults is their coping abilities. They find it so difficult to cope with stressful situations. They find it difficult to cope with difficult situations in tough academic environments. They're not able to balance, and that requires sort of working it out in a way with right type of programs, with right type of interventions. And there are quite a few, and it's not nothing new. There have been, some of them have been tested and tried out in many countries in the world. Some have shown to be very effective. So we need to understand what is it that works in our environment, and we need to take that and implement it in our level. So a broad level of integration using variety of different settings where we can put mental health into place, and implementing what is already there through different policies and programs around some of the aspects that we can take up for implementation. One of the most things that has also been not clearly addressed is when we did the ability of the Indian states to put in strong mental health systems in place, which we did as part of our National Mental Health Survey. To our surprise, we found that many states in India are still at a stage where they are not able to effectively implement mental health activities, mental health programs. There are many reasons for it, but we need to understand these black holes and then fix them so that mental health programs. For example, integrating mental health with the reproductive and child health programs, our elderly healthcare programs, our workplace prevention programs, suicide prevention programs. A lot of these things can be done, and it requires a systematic approach, a good level of integration, a high level of monitoring, and also finding out how effective are our programs so that we can have a good systematic approach to these things. Otherwise, it becomes very difficult to actually put things in place. We need that typical systematic, highly result-oriented approach in this. When I say result-oriented, it's not in bringing out more number of students at 90th percentile and above, but it's making students who are really able to cope up with the demands of today's life, as well as make them better citizens, and in terms of understanding and contributing for the society at large. I think that should be our larger focus rather than restricting ourselves to very narrow, fields.
Thank you, Dr. Gururaj. Thank you for sort of laying out those points so well in practical solutions. Vikram, I come to you now. Would you want to add to that with what Dr. Gururaj just mentioned? He spoke about basically a structural, result-oriented, systematic changes and various integration between various spokes that we have. You know, the health has to speak to education, education has to speak to health. It all has to be integrated. And he also made a point that, you know, while, for instance, you can measure how smart or intelligent a child is, but we don't necessarily believe in this. If he or she has achieved a 90 percentile, is it a score? You know, and maybe it sounds a very out of the box idea to perhaps test, you know, how mentally well, what the mental well-being of an individual. Do we have to work on something like that, and perhaps integrate that also in the education system?
So, I agree with everything, Professor Gururaj spoke to, and I just wanted to emphasize a couple of points he made, because I think they're really very important. The first is, the silo issue. This is again a structural issue, the fragmentation of very complex issues like health, public health. And, if there is a historic opportunity right now that the pandemic has thrown into the open, and not just in India, by the way, this is true in all countries, is that health is an all of government subject. And we don't even need to think about the narrow subject of the specific area of mental health, which is further siloed in health. But even just take health more generally, one cannot imagine a more all of government subject than health, more than any other subject. And I think the way that health has been siloed off in every government into a ministry with actually very limited traction, to be absolutely honest, when it comes to tough decisions, the Ministry of Health is not very high up in the pecking order. And I think we just lost Dr. Gururaj, unfortunately. So I think, ensuring that that the issue of health is reflected in every single policy. And if we had done that, for example, we would have had a very different education sector. If health had been a very central subject in thinking about how the education sector addresses the need of children and adolescents, we would have seen a very different kind of scenario, both in the way schools are organized and run, the way the curriculum is presented, and so on and so forth. So I think that is a very important structural issue that needs to be taken into account. The second thing he spoke about also is, speaks to the issue of accountability. Within the health sector right now, more broadly, and within mental health more certainly, there is very limited accountability. We have very few metrics that are being used routinely, which can then be used in real time by, for example, policymakers, by bureaucrats, to hold people accountable. Why is it, for example, that in India today, there is a never-ending occurrence of disasters in our hospitals? I mean, I don't have to list any one of them. You will know that our news is every few weeks there will be another catastrophe in a hospital. Oxygen ran out, 600 people died because something terrible happened in a particular neighborhood, etc. Why is there no accountability? All of these could have been eminently prevented. And I think the issue of accountability in health has always been a very important elephant in the room. And so I think that's the second issue that I wanted to amplify that Gururaj spoke to. The third thing he spoke to is about context. Context matters. And I think, again, the pandemic has revealed this in the full light, really. The idea that policies that might work in one particular context in order to control the pandemic can't simply be copied and pasted to another context. And I think the fact, and this is very true for mental health, is that our mental health is deeply influenced by the environment we're in. And one very practical example of that, which will illustrate this, is that most people in India do not conceive of their mental health difficulties in a biomedical way. We often think that the correct solution to this is to teach people the biomedical way of mental health problems. I don't think that's going to work. I think what we should be doing instead is adapting the mental health care system so that it speaks to people's own cultural and social understandings of mental health problems. Most people, for example, in the pandemic era, as an example, would see their feelings of depression, anxiety, sleeplessness, irritability, not as a mental illness. They'll see it as a reaction to an extraordinary situation that they're facing. And this is also true, by the way. It is, in fact, an extraordinary reaction to an extraordinary situation. But by hammering down to them and saying, you have a mental illness and you need to go see a therapist, I don't believe is going to actually be the correct strategy. we need to not only make psychological interventions and mental health care more available, but we also need to make sure that the way it's presented is not in a psychiatric diagnosis driven way, because most Indians do not embrace that particular idea. And I see no reason why we can't present these services in a way that they will find acceptable.
That's very well said, Vikram, and those are very practical insights. Vinod, you want to add anything to what Vikram, Dr. Gururaj just mentioned? I think some very valid and correct points made there.
Yes, I think on the structural side and the policy side, the problems that have been highlighted are pretty clearly the obvious problems. I would say on the ground, however, what we are observing is there is probably a lack of recognition of the problem itself, right? Firstly, like Vikram said, you got to recognize that you're going through a certain mental state of mind, uh, and what is the root cause behind that state of mind, to then be able to even think of what you can do to fix that, right? And I think specific to India, there's also a social stigma associated with anything to do with mental health, right? I mean, if you have a couple, and we face this in the office all the time, somebody gets married, they go into a high stress situation, because in India it's two families getting married, it's not two individuals getting married, and now they're going through a stressful situation. I don't think in our society there's any trigger point at which that couple would relate to or understand that they need help, right? By the time they think of getting help, it's almost the relationship ending stage, right? And I don't understand the science behind mental health related to suicide and such, but I'm sure it's a feeling of helplessness which might be driven through those basic emotions. Maybe an individual feels that they are not good enough, or whatever it might be, or they are not able to get to their goals or milestones, whatever those reasons. I mean, one of the things that has helped us a lot, and I'm sure Vikram probably knows this, is Professor Tal Ben-Shahar, I think, again from the Harvard community. He brought out a set of tools that our team could relate to. And one of the key things he touched on there was this concept of just an individual working on appreciating the good, in everything they do, versus appreciating the bad. So when any situation arises, let's say I go out there and I get into an accident on the road and I lose my right leg, I can look at that in two ways, right? I can look at that and say, oh my, why did I go out? For the rest of my life now, I'm going to be living in misery. Or I can look at it in another way, where I appreciate the good and say, you know what, I could have lost my life. If I had a choice of losing my life and just losing my right leg, what would my preference be? And this concept of appreciating the good versus appreciating the bad, given any situation, very simple thing, has been extremely helpful, surprisingly, because people don't end up in that situation where they're trying to look at the positive side of their situation versus the negative side. And again, history shows us that this does make sense to some extent, because we are driven by looking at data. So if you look at society 100 years ago, right, we are so far better off today than we were 100 years ago, right? So why is it that on a mental health scale we are probably less accomplished today than we are 100 years ago? It's probably because of these basic conditioning that we've gone through in our lives that is now changing, or has changed our priorities, versus just appreciating the simple fact that it's great to be alive and it's great to socialize with your friends, and it doesn't really matter that you don't have a fancy car or a fancy house. Honestly, that's irrelevant, right? But when people realize that, it's too late. You're running on this treadmill trying to keep up with the Joneses, as I was mentioning earlier. And the moment I think, so boiling it down, number one, we feel is recognition. And we see that with our staff. Does an individual recognize that their performance is being impacted? Are they willing to look at the root cause? Are they willing to look at the fact that there's something happening in their personal life that's causing that problem, right? And then are they willing to look at help? There is help, right? And in India, help is very accessible. If you're looking at the psychology aspect of things or the psychiatric aspect of things, the help is very accessible. You can just walk in and get help. But the social stigma associated with that is also a practical problem. So it's just interesting that we are where we are, and I think there's the spotlight is not on this problem, even though this might be the root cause of a number of issues in society. There is a lack of focus on this problem. So that's my take on this. Yeah.
Okay, I think we had this concluding remarks from all of you, set of solutions coming out. This is really the end of the conversation. Before we wrap up, I think it'd be a good idea to really understand about the impact of technology, which is all pervasive in lives of almost everyone. Do you think that the distraction posed by this, this entire online websites that we have with Facebook or Twitter or Instagram, people are actually suffering from what is, the attention span is so limited right now. Do you see this increased issue of mental health in perhaps Gen Z and millennials? What really is the issue there? And I want to understand from Vikram perhaps that this entire automation wave that we are seeing right now, do you think it would be a good idea for people to rather work with bots rather than human beings? When you work with human beings, perhaps it just gets very complicated. Then the entire negative emotions seep in, workplace politics. It might sound sort of very out of the box and utopian right now, but do you think the world where the human beings and bots are co-working together perhaps could be a happier world?
So these are questions which there's no definitive answer, and I think the jury is out on all these questions you've raised. What we do know right now is there's a lot of interest in the question of social media and its impact on mental health, particularly of children and young people. A couple of things we do know is that there is a developmental difference between young children and adolescents and young adults, and so there may not be a single answer that applies across the full early life course from 0 to 24. It's very likely that for very young children, the impact of a lot of screen time and social media may be quite different to that of adolescents and young adults, and could be actually more harmful in children. Mainly because I think the brain is a much more plastic, it's much more developing and much more shaped by environment in early childhood than in adolescence. There is a large body of research now examining the impact of social media, screen time, etc., on mental health and development. And I'll tell you, it's a very mixed picture. It isn't like, for example, smoking. No amount of smoking is good for your health. But with social media, it's much more nuanced. It turns out that what we do need to understand is not just whether you use social media and for how long, but what's the quality of that engagement. What are you using the social media for? And what are the reasons for actually using social media? And you discover actually that those individual characteristics are almost more important than the amount of time on social media to determine whether or not it will be helpful to you, and it is helpful for many young people, or harmful to you. So I think the jury's out, but I think it's going to be a far more complex and mixed picture than, say, for example, we'd like to think with some other kinds of examples of risk factors for poor health. Social media definitely does not fit into that picture. The issue of automation, I hope to hell that we don't live in a world where we can replace human interaction with chatbots. That said, I think the question you asked is, can they coexist? Yes, I think they can. There's some really exciting new work in which chatbots have been able to mimic human interaction so closely that actually it's very hard to tell whether or not you're having a conversation with an automated chatbot or with a real person. And why that is helpful in some ways is because a lot of first level counseling interventions can potentially be, as it were, shifted to chatbots just at the first level. And if that is not helpful enough, you can actually then move on to a human interaction. Let me tell you, this is already happening in many business sectors, and Vinod will, of course, speak to that. How often do we get onto a helpline for anything, an airline ticket, or because our telephone isn't working or whatever? And the first in point of interaction for so many business and consumer activities now is an automated system. And if after you go through all those automated systems, sometimes they can drive you crazy, of course, but if you can go through those and not find an answer, you will finally land up speaking to a human provider. And I think this might well be something that also is going to happen in the mental health and indeed the health sector. By the way, this also happens in other areas of health. So I do see that there is a place for coexistence, as long as we do not ever assume that an automated system can replace a human interaction.
Yeah, I hope we sort of do not have that, we do not see that very soon. But I think the automation wave is really upon us. I think my last questions to all of you, if you were to use this forum or a platform as an appeal to the policy makers to really use this crisis as a great opportunity to transform the mental health issue, what would that really be? One practical appeal to policymakers. I'll start with you, Dr. Gururaj.
Basically, one thing, if we need to develop a very broad-based approach to addressing mental health issues in society. There is nothing like one single solution that can work to provide answers for all the problems that we have. So, but there are many things that are there, some which are coming in. For example, I think when I joined, Dr. Vikram was talking about telehealth, telemedicine, teleservices, which are coming in a very big way into the healthcare field. So like that, there are several other opportunities. So one thing if we need to do very systematically in the coming years to provide more solutions to the mental health crisis is to integrate more of mental health into many other areas. And this integration should not be at a verbal level, but it should be at an activity level, and it should be broadly linked to the policy issues that exist in whether education, whether health, welfare, law, other areas, other domains that are impacting us in direct or indirect manner. So a broader integration of mental health into all existing activities using more technology-based platforms, because we are still not back into the normal days, using all technology-based platforms and doing it on a day-to-day regular basis to build capacity within the society to address this. As long as we don't have the required capacity to do it, we'll all be talking about this. But it's required that these capacities are built among policymakers, among professionals, among public, among the media professionals, general society, everyone who is directly or indirectly connected with another human being, and mental health plays a very central role in that entire interaction.
Okay. Vikram, any points you want to add there? Appeal to the policymakers.
Absolutely. And I completely agree with Dr. Gururaj. Yeah.
Okay. Vinod, anything you want to add onto that?
Yeah, I would say, I also agree. I think there is the spotlight needs to be on this issue, and that's the recognition part that this is indeed a problem. We've seen a lot of issues in the recent past in our country in relation to celebrity suicides and such, and everything that's driven by those cases. But nobody's still really paying enough attention to the root causes. The other thing you mentioned about this transition to the world of automation, I think it is inevitable. I mean, we are right in the middle of that in the work we do. I mean, I think the net positives of all of that is even the tools that come about, that exist now. If you look at the COVID pandemic, I think the social situation would have been a lot worse if we didn't have these video conferencing tools at our fingertips and the ability to collaborate and socialize with friends and family, even though you're contained within your home. So I think those are net positives. My 5-year-old son, just thinks that Alexa is a friend. He doesn't understand that it's a technology, right? Because in his world, that entity exists. And I think even in the United States, as I'm sure Vikram will know, I mean, this is now proving to be a very positive tool for the senior citizens who go through high bouts of loneliness, that they actually can communicate effectively with a bot, right? Like Alexa, I mean, more sophisticated bots, but like conversational bots on their day-to-day schedules, right? So I think we are transitioning to a new world. It's a net positive going forward. What we can see a lot more of, hopefully, is the government and policymakers maybe shining the spotlight on the issue to recognize that it exists. Once it's recognized, I think everybody's going to seek solutions. The problem is just the lack of recognition. Thank you.
Okay, thank you,
Shrita,
gentlemen.
I just would like to add a point. While we in this world, wherever we work and whatever we do, we always progress so much that we recognize the problems which come at a later stage. With technology usage also, we have already learned, and there is enough data to show that technology-related mental health problems are also a big concern. So we need to recognize these problems at the early stages itself and try to address it right from the beginning. Not when everything gets out of control and when we are in a stage where we can't do anything. And we can't come back at that time 50 years back. So we know technology is a very powerful tool. It's a good friend of individuals and it can do a lot. But we also need to recognize its limitations and the pitfalls within that. And address it right from the beginning so that it brings lesser harm and does more good.
Okay. Thank you, gentlemen. That was extremely insightful and meaningful. I'm sure our audiences will learn and draw these practical insights and perhaps deal with mental health issues far better. I usually do a rapid fire at the end of my conversation, especially, and that's been like a constant feature, especially in the India Restart series. But I do think this is a very serious topic, and I would not like to trivialize it by doing fun questions. But if any of you could take a stab at this, one heart-wrenching experience that you've had when you've dealt with mental health issue, any of the people that has really sort of been with you over the years, and like quickly in 2 minutes want to talk about it, we can hear from you. Perhaps any three of you.
I mean, I would just speak to witnessing or hearing about individuals like Robin Williams committing suicide or Anthony Bourdain committing suicide. These are like, individuals that are looked up to for all the obvious reasons. And then you question, what situation might have existed in their minds to drive them to such an extreme step, right? So it's in some ways it's almost reassuring that just climbing up to the ladder to get to a position that these individuals have attained doesn't necessarily mean you're going to be in a happier state of mind. So that's what comes to my mind.
I think for me, the most heart-wrenching, accounts are, of course, in my own personal life. Many people who have mental health problems, but the most heart-wrenching stories are the ones you read every now and again in our newspapers of young lovers who kill themselves because their families refuse to accept who they've chosen. I cannot imagine a more cruel end, and it's a telling example of the fact that mental health problems don't exist in a vacuum. They're not just purely driven by our biology. They're driven also by the social world we live in. And we live in a country where many, many parents continue to deny the rights of their young people in their families to choose the people they love and indeed choose the occupations they love. And I would say a very large number of suicides in young people today are not because of the biology in their brains, but actually due to the oppressive, repressive, social, orthodox circumstances that they find themselves in. That is very, very heart-wrenching for me.
Wow, Vikram. Dr. Gururaj, we would like to hear from you.
Well, I mean, one of the things apart from many of the personal, instances that we have all encountered in our day-to-day lives is basically the changing the societal patterns. And many a times I'm so concerned about our younger generation. It's a stage which is the most healthy, happy, and the most productive part of their life. But we see in this age people succumbing to mental health issues, whether it is addiction problems, whether it is suicide at a very early age, whether it is depression, which forces them not to get into work or to have a good family life or anything. The health of the younger generation is a matter of serious concern. And I think we need to look at it more seriously. We all know many personal stories with which we are very closely associated and which has definitely impacted all of us at some stage in our life. But I think there's a larger societal concern which we need to acknowledge and take corrective action in this time.
Thank you, gentlemen, Vinod, Vikram, and Dr. Gururaj for being so candid with us and sharing all those practical insights. I'm really grateful to all of you for sharing your time and energy with us, especially on a day which is auspicious and a Diwali. And thank you, gentlemen, and wish you and yours a very, very happy Diwali. Until the time we see you next, goodbye and good luck, and do stay safe. Thank you.
Thank you. Happy Diwali.
Thank
Thank
you,
you, Shrita. Happy Diwali, everybody. Yeah.
Bye-bye.
Thank you.